Good afternoon, everyone, and thank you all for being here. I want to start by recognizing a lot of leaders who are here with us today because I think this announcement is important to all parts of the city and a range of different industries. Let me start with thanking and recognizing CDPH Commissioner Dr. Arwady, BACP Commissioner Rosa Escareno, Deputy Mayor for Neighborhood and Economic Development Samir Mayakar, Alderman Emma Mitz from the west side, Alderman Tom Tunney from the north side, Illinois Association President and CEO Sam Toya, our good friend and partner in crime, Club Pilates studio owner Abby Phelps, owner and executive chef of Virtue Restaurant Eric Williams, and Brian Fitzpatrick, co-founder and CTO of TOC, who's going to talk about a very innovative technology app that'll help facilitate, I think, a number of things in the restaurant and hospitality world. Over the past 6 months, we've had to make difficult decisions, as you all know, all of which were rooted in what we were seeing in our city's COVID-19 data. Asking residents and workers and businesses to make a lot of sacrifices in the name of public safety and public health. And people have risen to the occasion all over our city. It was because of this citywide cooperation and collaboration that Chicago never saw a huge surge in cases once we started to gently reopen. All the modeling predicted that we would see a surge. The question was only how large, and luckily, because of all the hard work and sacrifice of so many, including individual residents, that fate didn't come to us. However, COVID-19 is still here, and we must still remain diligent. But as a result of all the work that's gone into our response, we remain the most open big city in the entire country. And that's what makes today's announcement even more important. Today, we're coming together to announce that our city has made sufficient progress in the fight against COVID-19 to ease some of the restrictions on our businesses and give them more ability to grow and to earn revenue as we start to head into the winter months. Now, we still have a long way ahead on our recovery journey. I think everybody can understand that. Being able to open further today is just one small step we're taking based on what we're seeing in the data. And let me also just say, this announcement today is a result of partnership. It's a result of communications. And I've got to thank Sam and members of the hospitality industry, individual restaurateurs who have really been diligent in the sacrifices that they've had to make, but also been very consistent in their advocacy if the data was right for us to do more, and that's why we are here today. It also means that difficult decisions and sacrifices that we've all had to make are moving us slowly but surely forward. And that along the way, we must continue to adapt and learn, especially as the weather gets colder, so we can provide for and protect our residents, our workers, and our business community. As we're all aware, COVID-19 has taken a devastating toll on our businesses, who are forced to close their doors, furlough workers, or even shut down in the early stages of the pandemic. This is in no way, shape, or form a sustainable economic environment, and we all know that. All of us have been dramatically impacted by COVID-19, and our city's revenues have taken a substantial hit, as we all know. So today's announcement is not only foundational to the economic recovery of our entire city, but also for the businesses large and small that are our city's backbone and that help our communities thrive. Starting this Thursday, October 1st, Chicago will ease 5 of our Phase 4 guidelines for businesses, and let me outline those. Number 1, indoor capacity will expand from current 25% to 40% for businesses, including restaurants, health and fitness centers, personal services, and non-essential retail. Maximum capacity for any space remains at 50. Second, breweries, taverns, and bars may reopen with indoor seating at 25% capacity or 50 people, whichever is fewer. Third, bars and restaurants serving alcohol will now be able to continue serving until 1 a.m. and remain open until 1:30 a.m. Fourth, The maximum group size of health and fitness classes and after-school programming will increase from 10 to 15. And finally, personal services that require the removal of face coverings, such as facials and shaves, will now be allowed. To mitigate the risks that come with increased capacity, and there are risks, make no mistake about it, we will be putting 4 new protocols in place. First, unless actively eating or drinking, diners at restaurants must wear face coverings while seated. Let me say that again. Unless you are eating or drinking, you must wear face coverings while seated. Now look, as a person who tries to dine out and support our local businesses, I know that this requirement is a pain in the butt. Let's just be blunt about it. But it is absolutely necessary to protect you, protect other diners, and importantly, protect the workers who are coming to your table. So we've said, and we know that this is important, when you are engaging with a service person who comes to your table, whether it's the person bringing you water, checking on how you're doing, or your waiter, you must wear a face covering engaging with others. That's critically important, and we're encouraging you, when you are not actively eating or drinking and you're just talking to the person that you're dining with, wear a face covering. Because it's not just about you. When you leave, whatever you brought in, whatever you've done during that dining experience stays, and the workers have to clean up, and they're putting themselves at risk. So please wear a face covering while seated when you're not eating or drinking. Second, there will be no walking up to the bar. Breweries, taverns, and bars must have customers seated when eating and drinking and ordering. So I know we're all used to going up to the bar to order whatever it is that we want. That will not be allowed. People will come to your table where you are seated to take your order. Please make sure that you abide by this restriction on bars and taverns. Third, personal services requiring the removal of face masks should be kept under 15 minutes. Now, again, I know to get a shave, to get a facial in 15 minutes is a big ask, but it's an ask that we are making, obviously, for public health reasons. And the employees conducting the service must have a face covering on at all times. And I think a lot of the personal services folks are doing a terrific job with this, but we want to make sure that we emphasize this because it's important. And fourth, all places of business should provide hand sanitizer to customers and employees upon entry. Now, a lot of folks are doing a great job with that, but we want to make that practice uniform. That's important. I'm also pleased to say that thanks to our city's partnership with the technology company TOCK, and that's T-O-C-K, which is developed right here in Chicago, more businesses will be able to assist in our city's contract tasting efforts through their reservation system. Through this partnership, TOCK will provide free setup and a 6-month subscription to TOCK Plus Lite to restaurants and bars without reservation systems in areas of our city below 60% of the area median income. What we're trying to do is make sure that when people come into your restaurant, come into your place of business, that there is a way to know who is there and to track them in the event that we need to do a case investigation or contact tracing. This is being done in other parts of the world and other parts of the country. Now we have the ability to bring it right here in Chicago, and we'll talk more about that. This gives technology solutions to businesses in low-income areas that may need these enhanced capabilities simply to survive. This partnership reflects our city's commitment to inclusion and innovation, and will also help further slow the spread of this disease by quickly connecting people with the testing and care that they need should they or someone they know come into contact with COVID-19. Today's new guidelines are the result of the hard work and hard choices our residents, our workers, and our businesses have made to keep our entire city safe. They mean that we as a city are making slow but steady progress in our recovery efforts. But what these new guidelines do not mean is that we are out of the throes of this disease. Not so. Unfortunately, we're seeing states nearby and across the country open up entirely as if COVID-19 has suddenly disappeared. It has not. We continue to see new cases every single day. We continue to see new hospitalizations every single day. And while the number of deaths that we're recording every day has gone down substantially from its peak, people are still dying from COVID-19. So we have to remain diligent in our approach to making sure that we do everything that we can to respond to this horrible, horrible virus. Earlier this summer, we lost progress. Back in August, we saw cases really shoot up. And it's taken us some time and a lot of work on the part of a lot of different folks, including our fearless public health department workers, our community partners, to work to bring the numbers back down. We also heard complaints from workers that were being put in unsafe positions because their employers weren't complying with city guidelines. It's critically important that as we take this next step forward, that all of our workers know that we are here for you, and we will step in to protect you if you do not feel safe in your workplace. And the flip side of that is employers, our expectations is that you are going to do everything you can to keep your workers and members of the public safe from this virus. Many of you got the memo months ago and have done extraordinary and creative things to keep both your workers and members of the public safe. But we need to remain diligent, and we need you to step up and dig down a little bit deeper as we relax some of the restrictions in this next step. Before I close, I really want to, again, thank everybody who's come here today. I want to thank our Department of Public Health for always being diligent, working hard, and being open to conversations with businesses around how we can get to the same place, but get there safely. That's very important. We will continue the important dialogue that we've had with residents all across the city, businesses of every type, to make sure that we remain the safest big city, the most open big city, and that we continue to make progress in our continued fight against COVID-19. And at this point, I'll invite Dr. Arwady to the podium to provide further details on where we are as a city. Doctor?
Thank you, Mayor Lightfoot, and good afternoon, everyone.
Good afternoon.
So my goal today is to talk you through the data. The reason we've made this decision today is absolutely based on the framework that we put forward on June 26th as we moved into phase 4. I know not all of you follow along the reopening guidelines on the website every day like I do, so I wanted at a high level to remind you of what the things are that we're tracking and why we feel confident that we can take this careful step, but also all of the things that we will continue to monitor so that if we start to see trouble, we can pull back. The hope, of course, is that we will continue to build on the progress that we've seen over the last month and be able to continue to take steps forward. But what we outlined here on June 26th, and you can find the details on the website, are what we continue to use. So first, I want to highlight that there are 4 things that we track that do not have a number goal on them, but they have to do with whether we're seeing increases, decreases, or things being stable. So that's our case count, which we talk about every day. It's our number of hospitalizations, our number of deaths, and our number of emergency department visits. In the green, this basically means we're seeing stable or decreasing numbers over a particular period of time, and we're able to move ahead. Next is the positivity rate, which I know you've also heard a lot about. And you'll note, to be in the green there, we have to be under 5%. And that one has been hard for us to get to over the last few weeks, but we are there now. And then there's 3 about capacity: hospital system, testing, and response capacity. So I'm going to talk you through each of them. Go ahead. Cases. You all are very used to this graph at this point. This is the cumulative total of all of our new cases. At our peak, we were seeing about 1,000 new cases a day here in Chicago. We'd gotten down under that 200 case per day mark briefly, and then saw over the summer an increase, and then just over the last month have started to see some decrease. We're at 299 cases per day on average. We're going to focus now on what's happened in phase 4, which is gradually resume, for all of the rest of the slides. So in phase 4 on cases, this is the same graph from before with some more details. What you see is from late June all the way up until August 24th, an increase. Week after week after week, cases going up, and positivity was not in the right place either. But the good news, while we peaked at 358 cases per day, is that since then, we had a brief dip related to testing over Labor Day, but we now have more than 28 days of slow but stable decreasing in numbers. And that's one of our metrics for being able to move ahead. You'll note for cases, there's actually 2 metrics. One is this stable or decrease for more than 28 days, and one is having the sustained cases under 200. Go ahead. Hospitalizations, similarly, have been on the decline, you can see. Formally, they've been declining in a statistical way since August 27. We're down to 14 new hospitalizations per day. That is also in very good range. Next, deaths. This is also over phase 4. You can see that has dropped very nicely. And even though we saw some increases in cases, largely because we were seeing those in younger people this time, as opposed to older folks who were really hit hard the first time around, we didn't see the big hit on hospitalizations or on deaths. So also, we've been making very good progress here. And then emergency department visits. These are not diagnosed cases of COVID. This is one of our systems where we look for people who have symptoms that may be COVID. It's one of our fastest alert systems. And you can see relatively flat, and then really right at the end of August, for the last 28 days, a very nice decline in terms of people coming to the emergency department with COVID-like symptoms. And then positivity. So this is a little bit of a confusing, it's always a little bit confusing when we talk about positivity because there's 2 ways we count it. But the bottom line is this again is over that phase 4 time period, and we want to be below 5% test positivity. We have to be below 5% positivity to consider moving ahead. And you can see that early on, we were below 5% test positivity. But then in August, got above, a little below, above, a little below, really just flirting with this 5% line, not able to regularly be below it. But now, and since September 10th, which is more than 14 days, we have consistently been able to see that percent positivity under 5%. We're at 4.3% today on test positivity, which puts us in that continued progress green range. I do want to note our person positivity, which is when we count one person and one test, does remain above 7%. So we track both of these, but this also was some very good progress. And then quickly on hospital capacity. All of our capacity has been good throughout phase 4. You can see for hospital capacity, all the way since early June, those purple lines note where we need to be in green. And you can see that on the left, our hospital non-ICU beds, nice downtrend, continue to downtrend. Our level of concern is if we're at 1,000 beds that are full with COVID patients, and we're at 259 right now. ICU in the middle there, the threshold is 400 for major concern, and we're at 89, and then ventilators, the concern is 300, we're at 45. Again, there's been nice progress, largely because of the different age groups that we've seen affected, and that Chicagoans have done a good job of protecting those most vulnerable to severe outcomes. Testing capacity, similarly, here we want to be above that purple line, doing at least 4,500 tests per day. That marks the ability to test 5% of Chicago's residents every month. We've well exceeded this for more than 95 days. And then finally, our response capacity. This is our ability to have enough case investigations and contact tracers. We've hit our benchmark for that between the 75 and the 90% of cases assigned within 24 hours since June. So in summary, we're at a place to carefully move ahead. The restrictions that we're lifting today, we're excited about. because they mark progress, but we will continue at the health department to track all 8 of those indicators. And if any of them start to show signs of concern where we're in yellow, we pause. If we start to see things heading in the wrong direction for enough period of time as laid out in that graph, we might have to go backwards. But as long as we continue to stay in the green, continue to see progress, even if things are stable 28 days from now, we may, for example, be able to move to a 50% capacity. But we're going to follow, move ahead carefully. Now is the time to double down on the things that work, not to relax. And with that, I'd like to welcome Rosa Escareno, the commissioner from BACP.
Thank you. Good afternoon. My name is Rosa Escareno, and I'm the Commissioner for the Department of Business Affairs and Consumer Protection. 6 months ago, I stood with Mayor Lightfoot and Governor Pritzker as they announced the closure of restaurants and bars across the state. A day we never thought would be here, a time full of uncertainty, fear, and anxiety for everybody. The challenges over the next 6 months were truly unprecedented, and we asked our businesses to make very difficult and critical changes throughout that time. And they stood up to the challenge every single time. Putting the health of our residents first, and in a true Chicago way, we all came together to face the challenges and to work hard to ensure the safety of our city. And it's because of these efforts that have led us to this change today. And I am full of hope as we announce the easing of these business reopening restrictions. And I strongly believe that we can take this step because throughout the crisis, our business community has complied with the orders that we have put in place. They have kept the workers, customers, and our community safe. We can take this step because the residents, as customers, have shown that they care about our fellow Chicagoans by masking up, social distancing, washing their hands. They are protecting the workers at their local restaurants, barbershops, and gyms. And we can take this step because our essential workers have kept our city running during this crisis and are enforcing the guidelines as we reopen to ensure that we are keeping everybody safe. Businesses have been doing their part, and since June, we have conducted over 2,000 investigations of businesses, yet we've only cited 6%, a clear indication that they're working really hard with us. But make no mistake, because we will make sure that they continue to follow these new guidelines. And as my department, along with all the city agencies have been doing, we will continue to establish the protocols that have been in place. So we will continue calling and holding webinars to make sure that every business understands the new requirements. We will maintain our strict enforcement, responding to complaints, and now also conducting proactive visits to bars, restaurants, gyms, barbershops, and all the other businesses throughout the city. We will continue our efforts to crack down on large commercial gatherings. As you know, the mayor instructed me to put together a task force to address those large gatherings. This is not the time to be having parties because, again, this goes to protecting our residents. So today is the day that we look forward to the recovery of our city with true hope and optimism. And I ask, as the mayor and Dr. Arwady continue to remind us, we are not out of the woods yet. And so I encourage all of you to continue to work together with us so that we can keep our city open, keep our workers working, and keep our residents safe. We have to do this for the health of our city. So I want to thank you for all your partnership, to all the businesses and the aldermen here today. And Sam, thank you for working with, excuse me, I have a cold. Thank you for working with us. And now I'd like to call Samir Mayakar, Deputy Mayor for Neighborhood and Economic Development. Thank you.
Thank you, Commissioner, and good afternoon, everybody. As you heard, my name is Samir Mayakar, and I'm very proud to serve as Mayor Lightfoot's Deputy Mayor for Neighborhood and Economic Development. Now, as the Mayor mentioned, we continue turning up the dimmer switch gradually on our reopening efforts. And in particular, I want to highlight the true willingness of the business community to partner with the city and Mayor Lightfoot's team in supporting our reopening efforts with constructive guidance, financial support, and civic leadership. This continued reopening would absolutely not be possible without the leadership of the mayor and the joint support from businesses, community organization, workers, and all of our residents. So what I want to do today is to update you on the state of the Chicago economy and our recovery. We know that we are facing unprecedented times of economic crisis, and we are certainly not out of the woods. But there are some silver linings that we can point to here in Chicago. First and foremost is the fact that we remain the largest open city in America. So I thought I'd start with some data on small businesses. This is something personally very important to me, having come to this job after running a small business. Now, we have a partnership with the University of Chicago, and they track data from a company called Homebase, and it allows us to understand what's going on in our small business community. So what started after the shutdown, you can see a deep drop-off in hours scheduled and firm closures. And what started as a V-shaped recovery has started to plateau. And this is something we're seeing all across the country. Worker hours are down 35% from pre-COVID levels, and 25% of Chicago businesses remain closed. However, Chicago is in a better position than other cities. We are less impacted due to our COVID response as a city and that gradual dialing up of our economy. But what this tells you, the fact that Houston, Los Angeles, New York City are further behind us in terms of the health of their small business communities, this tells you that we need federal leadership and federal support of our business community. What this also told us and our team is that we needed to do more as a city. So Mayor Lightfoot challenged us to provide a transformational level of support to our small business community. And to date, we've allocated nearly $150 million to directly support small businesses in Chicago. Now, if you compare that with our peer cities, this is 300% more support than New York provided, and it's more support from a municipal standpoint than the top 5 cities of America have provided to their small business community combined. But the support is not enough. It's also about how those dollars are allocated. And if we look across our city, we took particular care to make sure that we are filling in the gaps from what wasn't covered in the federal PPP program. So what you see here in purple is a mapped out level of the $3.8 billion of federal PPP money mapped across our city. And on the right-hand side, you'll see that we've taken particular efforts because Mayor Lightfoot challenged us to take an equity lens with our small business support to provide support to who fell through the cracks of the federal PPP program. So you see a particular concentration on the Northwest, the West, the Southwest, and the South sides to making sure that we're supporting those businesses that might not have stable banking relationships and might not have tapped into that federal PPP program. Now, moving on to consumer spending. We have a partnership with Bank of America, and they have a detailed breakdown of their millions of customers in terms of credit card spend and debit card spend, which we can use as a proxy to overall economic activity in our city. And this is something that they compare all across the country. And what this data has told us week after week for the past 3 months is that Chicago has the largest amount of spending growth in terms of consumer spending of any big city in our country. So we are happy about that. Now, obviously, it's not enough. We know that there's still more to do, but this fits in with that theme that we've handled this crisis about as well as the city can handle it. And it's also due to the underlying strength and diversity of the Chicago economy, because as you know, no one sector of the Chicago economy occupies more than 14%. Moving on to real estate. We are in frequent contact with our friends at the Chicagoland Association of Realtors, and we thought we wanted to provide an update on how we're doing in terms of home sales and condo sales. So year to date, if you just look at the single-family home market, it's actually never been stronger in recent history. We're at an all-time low of inventory. In fact, median sales prices year on year are up 8%, and inventory is at a historic low. Moving to the condo market, it's very stable. We have a comparable number of listings year on year. The median sales price is up 7%, and inventory is stable. So we see a strong real estate market here in Chicago. Finally, I wanted to highlight some recent wins. There are so many companies growing here in Chicago that are in line with our recovery plans. And I want to note that under the mayor's leadership, we published the first recovery plan of any American city. So Amazon will be growing in Chicago, creating thousands of new jobs, and they have a steady pipeline of new last mile facilities that will be growing in our city. Secondly, the Department of Energy has made $230 million of investments in quantum research in the Chicago economy, and that will pay dividends in terms of startup activity. Third, just a few weeks ago, Xeris Pharmaceuticals, a pharma-based company in San Diego, announced that they're relocating their research and development operations to Chicago from the West Coast. So we have net regional growth in our life science sector, and their facility will be in Fulton Market. And finally, New Cold Advanced Coal Logistics. Our recovery plans call for the growth in the food and agriculture sector, also in warehousing. And this is at the intersection of all three because it's a cold storage facility, and we expect many more of these to come. Now, there will also be a pretty big announcement coming in the next day or two regarding a major corporate headquarters, so stay tuned and pay attention to that. So to recap, economically, we are the largest open city in America. We have the first recovery plan of any major American city, and we encourage all of you, our residents, to eat, shop, and live Chicago. Our team knows that the city is going to get through this pandemic and that together we're going to build a more equitable, thriving business ecosystem for everyone. Thank you very much. And with that, I'd like to introduce our friend Sam Toya from the Illinois Restaurant Association.
Excuse me. Thank you, Deputy Mayor. Again, I'm Sam Toya, President and CEO of the Illinois Restaurant Association. As a city, we've been through tremendous hardship over the last 6 months. Our restaurant and hospitality industry, particularly, has been decimated by COVID-19. 55% of the Illinois restaurants say if things don't change, they will go out of business in the next 6 months. But we're here for change. Overall, 63% don't expect their staffing levels to return to the pre-COVID levels for the next 6 months. In Chicago alone, there are 171,000 jobs in the hospitality restaurant industry at our 7,200 restaurants. In impossible circumstances, Mayor Lightfoot and her team have continued to lead the city in a pragmatic way that balances the public health of Chicagoans and the welfare of businesses that drive our economy. Throughout the expanded outdoor dining program and winter dining design challenge, the city has been proactively working to find creative solutions to support the neighborhood businesses we all know and love. The safety and well-being of our team members are always at the top of our list. The safety of our team members and guests, we get that in the restaurant industry. And we're taking every necessary precaution to create safe and welcoming environments. We've collectively worked to affirm that our restaurants are serving you safely, then, now, and always. Thanks to the city's balanced approach, Chicago economy is more open than places like New York and Los Angeles, and our COVID indicators are headed in the right direction. The IRA remains committed partner to the City of Chicago to ensure that all necessary health guidelines, such as mandatory face coverings and social distancing, are followed by all eating and drinking establishments. Covered faces keep open places. We understand that. Increasing occupancy and extending our hours of operation will help give struggling restaurants and bars a chance to see light at the end of the tunnel. Allowing large restaurants to have needed flexibility to divide their indoor space is another helpful regulatory action. And finally, thanks to the team at TAC, restaurants across our 77 communities will have access to cost-effective and beneficial partnership opportunities for ordering and reservation. These are constructive steps in the right directions that will allow more restaurants and bars to keep their doors open and provide thousands of jobs to Chicagoans. But we really need the federal government to step up for the independent restaurants here in the city of Chicago and throughout the nation, like they have in the past for the airlines, for the banking industry, for the auto industry. So we encourage the federal government to please look at the Restaurant Act and help our independent restaurants. As we all know, restaurants are the soul of every neighborhood here in our 77 communities, but throughout the country. So we're looking forward to working with the federal government on that. On behalf of the IRA and the restaurant community of Chicago, I greatly appreciate the level of consistent communication and engagement from Mayor Lightfoot and Deputy Mayor Markar and our leaders at City Hall. As I always say, communication and education is the key to success, and Mayor Lightfoot is always willing to communicate, educate, and it's always a two-way street. And that's what I really appreciate about working with Mayor Lightfoot and her team. They're always there 24/7 to communicate and educate both ways. We're all in this COVID-19 fight together, and it will take continued collaboration between businesses, elected officials, public health experts, and community leaders to keep a strong and steady path for recovery. So I want to thank you, and I want to invite Abby Phelps, the owner of Pilates Studio, up here.
Thank you, and thank you for the opportunity to be here. As Sam said, my name is Abby Phelps. I own 3 Club Pilates in Chicago, but I'm here as a board member of the Illinois Fitness Association to remind people that studios and gyms are inherently safe. As an industry, we've taken the Illinois Fitness Alliance pledge to wear masks and practice social distancing to keep our members and staff safe at all times. States with contact tracing like Louisiana and Colorado have found that fitness settings are among the least likely source of spread of COVID-19. In fact, the fitness industry is a critical part of the healthcare solution to COVID. Exercise fights many of the comorbidities associated with severe COVID cases and reduces depression and anxiety in a year that has taken a major toll on mental health. As Chicago turns cold, clubs and studios will become even more important to keeping Chicagoans safe, healthy, and active. Everyone in our facilities wears a mask the entire time, making us among the safest places to recreate indoors. Chris Whitty, England's chief medical officer, their version of Dr. Fauci, has said, "There is no situation, no age, no condition where exercise is not good. We all need stress relief, and we need it in a safe environment." We appreciate the opportunity to work with the city and Mayor Lightfoot's office to figure out the safest way for gyms and studios to stay open and to continue to increase capacity to keep the greatest number of members healthy and the greatest number of our staff employed. Thank you so much, and I would like to pass to Brian Fitzpatrick of TAC.
Thank you.
Thank you, Abby. As you said, I'm Brian Fitzpatrick, co-founder and chief technology officer of TAC. TAC is the only unified system to offer reservations, takeout, delivery, and events all in one place, while at the same time helping restaurants to know their diner. We're currently the fastest growing reservation system in the United States, operating in over 200 cities. As a locally grown Chicago business, we're thrilled to partner with the city to help expand safe dining and help restaurants build a bridge to the future. For many restaurants and bars, especially those in historically disinvested areas, technology can make all the difference. Access to reservation systems during this critical time will help businesses keep pace while ensuring they comply with reservations and keep both their employees and patrons safe. Thank you.
Happy to take your questions.
Mayor, thank you so much. Of course, I'm getting questions from my fellow journalists who are asking, why now? When there had been so much talk early on that the city had to be below 200 cases per day to ease any restrictions, and you're not at that. We're at 299.
Yeah, I don't know that we said 200, and I'll let Dr. Arwady talk about the specifics, but look, we have seen a consistent enough progress from where we were back in late July and early August, and then a lot of conversation with various industry sectors. We're always going to follow the public health guidance, full stop. And we believe that seeing the trends over the last 28 days, that we can safely take this next initial step. And we also need to be mindful of the fact that our businesses have just been devastated by COVID-19. And so we're at a place where we feel like the public health guidance allows us to take these next steps, so we're taking them. Now, if we see a problem, and everybody knows this because we are in regular dialogue with virtually every industry sector out there, if we see something headed in the wrong direction, we're not going to hesitate, as we did before, to step back. But we feel confident enough in the numbers, as Dr. Arwady outlined in her statement, that this step is carefully done with a lot of support from us, a lot of communication with the hospitality industry, the gyms, and other venues. We haven't talked about the faith community, but this affects them as well, that we can take these next steps safely if we continue to remain diligent. Dr. Arwady?
Thank you. Janelle, could you just pull up my first slide? So what we actually laid out when we moved into phase 4 were 2 different options for being in that advanced progress move ahead. And I just want to pull it up again. So if you look all the way on the right, for cases, we specifically called out stable or decrease for more than 28 days, and or sustained less than 200 new cases per day. And we did that recognizing that under 200 cases per day puts us out of the high incidence category, but recognizing that if we were not necessarily going to get to 200 cases per day, if we had seen at least 2 incubation periods of progress and everything else was in the green zone, meaning the positivity was under 5%, our capacity was good, we would be able to move ahead. And so the fact that, we waited basically that 28 days to make sure that we were seeing that decrease. We had that little dip over Labor Day, so we had to make sure that wasn't anything that was going to be a problem for us. But at the end of the end of the road, you can't make opening decisions at a time when you're having a significant increase. It's not safe. If we're going to try to move ahead here, and everybody recognizes that we're moving into colder weather, the time when we've been on a consistent decrease for a month and everything is in line with what we laid out, it's the right time to move ahead cautiously, as we're doing, and we'll keep following that data and keep using these exact same metrics that we laid out to make further decisions.
May I ask you one more? The cap for restaurants remains at 50 people maximum per room.
Yes.
That means a restaurant with a capacity for 200 will not be able to seat any more people starting October 1st than they can today. Why wasn't the cap increased?
So we certainly talked about that. And again, we are being cautious here. As you know, we're not below that 200 cases. It's just been 14 days that our percent positivity is under 5%. And we wanted to work on being able to have some expansion, like with the hours, like with the capacity. But we do want to keep, for now, that limit of 50 per room. And as we've shared previously, that's just based on how many cases there are in Chicago and the risk that in a setting with 50 people, there's more than a 15% chance that somebody would have COVID in a group and not be aware.
Also, I'm hearing, next question, a lot of Chicago restaurant owners wonder why they can't have 10 people at tables compared to the rest of the state. Why is the city keeping it at 6? And what will it take to change that number?
Yeah, so once again, we are making decisions here in a way that is careful and that the hope will let us continue to move ahead. If we were to open everything up right now, I am confident that unfortunately we would see a big increase and we would have to take big steps backwards. We're trying to do this gradually, conscious of course that colder weather is coming, and as we continue to see stability or progress in our numbers, we can continue to look at some of these options. But there is still a lot of COVID here in Chicago, and the fact is, when you're dining, you don't have a mask on by definition. We've not figured out a way yet to eat through a mask. So eating and drinking in a restaurant just is a higher risk activity. And so we want to keep that limit to 6 and want those people to be within an existing bubble as much as possible.
Mayor, and this might be best for you, I think. What is the status of the service fee limit for third-party delivery services? As winter approaches, it seems that this could be a bigger issue in the coming months.
Well, I actually think that one of the things that I'm excited about with this new Talk app is that it will, I think, substantially reduce the potential for service fees. But that is something that we're looking at very, very carefully. My preference always is to try to educate people into compliance, but and we've been very, very direct with some of these companies that charge fees. We've seen things where they appropriate somebody's menu and make it look like they're actually in a business relationship and they're not. They have charged fees that are untethered from the service that they're delivering. So we've spent a lot of time being pretty direct with them about the do's and the don'ts, and it's my hope that we will continue to see progress. But if not, you know that there are ordinances pending by several members of City Council, and if we can't get the industry to be responsive, then we're going to have to do it for them.
What is the scientific reasoning for 40% and not 50%?
Well, again, I'll let Dr. Arwady get into the specifics. We've looked very carefully at what's happened in other parts of the state, the region, and across the country. And what we've seen is instances where you go from a modest amount, which is 25%, to a much higher amount. You see a number of things. But most importantly, we've seen cases increase exponentially. And so from day one of reopening back on June 3rd, we've taken the approach that we want to be cautious, we want to be prudent, we want to work with our businesses, but we want to do it in a way that we don't have to keep taking steps back. And I won't name names of different states, but we've seen other states, other cities go from essentially very low to very high quickly, and invariably, in almost every instance, they've had to dramatically take steps back. I think that's hard on everyone, particularly hard on those businesses who then hire people, think that they know what the capacity limits are, and then they hit a brick wall because the city or the state says, no, we got to go back multiple steps. We don't want to do that in Chicago if we can avoid it. We want to gradually ramp up, increase capacity, but we want to do it in a way that really is safe. And looking at what's happened across the country, we feel like this is the most prudent approach. You asked earlier, well, why not do 10 people at a table? Because we believe, based upon our research and watching what's happened in other parts of the country and the world, when you start increasing the table size, then you see problems. People are less adherent to the masking rule, less adherent to social distancing. This is a way. These are all thoughtful things that we have done, talking with our partners, but we think that this is the most prudent approach. And Doctor, I don't know if you want to add anything to that or not.
I would just add that I think one of the reasons, honestly, that we're at the point where we are to be loosening some of these restrictions is because we've been a little more conservative than much of the state has. Besides Urbana-Champaign, where there's a lot of testing and that percent positivity is under 3%, Chicago and Cook County are the only areas in the state that are under that 5% test positivity. And I want to do everything I can to relax these restrictions in ways that will be safe. My hope is that we'll be at 50%, a month from now, for example, but we would need to see continued at least stability, if not decline, just as we laid out at the beginning of phase 4. There are cities around the country that have used different markers for this. Seattle's at 30%, but it's about loosening not just that one thing, all of the various restrictions that we've done at once, and see how we go. And I think if people can be serious, wear the mask, do all the things that we've laid out, my dear hope is that as it gets colder and we move inside, we don't see spikes, and instead we're able to be up here a month from now with further loosening of restrictions.
Thank you. Mayor, folks are also wondering if the businesses are able to loosen restrictions, what's the status of schools? There had been talk of perhaps school in November. Where are you at with that? Is there still a possible hope of students returning to Chicago Public Schools in person in November?
We're not there yet, and we have to make these decisions in the next few weeks. Look, I, as a parent myself, with a school-age child, talking to parents all across the city who I know as friends, I know because we talk as mayor to resident. There's a lot of anxiety on the part of parents. Most parents don't sign up for effectively homeschooling. For those parents who are working parents, it's really difficult on them because they don't want to leave their kids alone, but then they must work. So remote learning has a lot of challenges to it. Most importantly is, can we continue to make progress to make sure that every single student is connected, is learning, and is making progress? These are all challenges that are exacerbated when we're talking about remote learning. We have to see more progress in order for us, I think, to have a conversation about in-person learning. We're not there yet. I hope that we will continue to see the progress that's been outlined here today, but there's also a lot of considerations. We have to think about the workforce, of course. We have to think about our principals, our teachers, our staff, coming back to work. What does that mean for them? What does it mean for members of that school community who are over 60, who have underlying medical conditions? Are we going to have enough of a robust workforce to be able to come back in person? There's a lot of conversation that we're having with CPS, and they're in turn having with the school community around what that would look like. So I'm hopeful that we will get there sooner rather than later, because I know that all remote learning is a real challenge for everybody involved, not the least of which the students and the parents.
The chances in November are more than 50?
I don't want to speculate about the chances. It's something we are focused on every single day, and we'll make an announcement relatively soon because we've got to give parents and the school community enough time to adapt if we're going to make a change, but we're not there yet.
As a former federal prosecutor, do you see any potential crimes in President Trump's tax returns?
Well, that wasn't a question I was expecting, but look, I think I'm, like people all across the country are waking up to the news that's been revealed by the New York Times. I'm not a tax expert, and I would never pretend to be one, but I am deeply disturbed by the fact that when hardworking Americans are paying their taxes and paying their fair share, the news suggests that this president has used every trick in the book to avoid paying his fair share. It's just a simple act of fairness. It doesn't seem right. It doesn't seem fair. And it explains a lot. It explains why he's gone to great lengths to avoid allowing us as members of the public to take our measure of whether or not he's living up to his responsibilities and his fair share. It certainly puts the whole tax bill that he pushed through in a whole new light. I think it's extraordinarily troubling. And look, I am fully in support of Joe Biden and Kamala Harris. No one has any doubt about that. I've been very, very clear. But again, when I think about the sacrifices that everyday Americans make to work their tails off just to put food on the table, clothing on the backs of their kids, have shelter, and for someone to use every act possible not to pay his fair share and then act like he's this incredibly successful businessman. Disappointing is not the right word. It's extraordinarily troubling to me. And obviously, the IRS is all over this because if the reporting is correct, they've been in a 10-year fight with this guy over auditing his taxes. He needs to come clean. He needs to take ownership. And frankly, if the reporting is true, he needs to apologize.
From Amy Jacobson, Mayor, as you know, the Census Cowboy has been arrested for taking his horse on a 7-mile gallop down the Dan Ryan to stress that kids' lives matter. Since he's broken a number of laws, including animal abuse, will you continue to have him represent the city? He hasn't represented the city in months, and I wish that Amy would actually do a little diligence before she asks these questions. Look, the sentiment that he was promoting, which is that kids' lives matter, of course they do. Each of us has been heartbroken over every single child who has been a victim of gun violence, and particularly those children who have lost their lives and the hole that puts in the hearts of the family of each of those kids. Everyone agrees with that. However,
as my mother taught me from a very early age, there's a right way and a wrong way to do everything. And what he did, putting himself at risk, putting that horse at risk, putting passing motorists at risk for that jaunt on the Dan Ryan was decidedly the wrong way. He almost killed that horse. Thank goodness we interceded, got that horse to an equine veterinarian that night. The horse was in shock. It had to be put on an IV. It's making steady progress, I'm happy to report. But he almost killed that horse. And then that doesn't even address the way that he put himself and passing motorists at risk, law enforcement at risk, over a stunt. There's lots of different ways in which you can make your point. But what he did was absolutely wrong. I'm not going to comment further since criminal charges are pending against him. But that is not the right way to get anything accomplished. Putting anyone or anything at risk really undermines, I think, the spirit of the point that he was trying to make.
Dr. Arwady, one last one then to Dr. Arwady from Amy Jacobson as well. The rest of the state is holding 20 contact days for all fall and winter sports. And you have said you will only let people play contact sports until there is in-person learning.
No, again, Amy, please, I know that you have a real point of view, but get your facts right. We don't make the decisions at the city level regarding sports. That is made at the state level. The governor and IDPH are the people who have made the decision about sports. Obviously, I'm a huge sports fan. I feel for these young people who lost a season last fall because of the teacher strike, are losing another season now. But we've got to do things in a way that keeps them and keeps others associated with the sports program safe. It's not just having the kids on the field. As you know, there's a whole infrastructure that's built up anytime we field a team, whether it's football, whether it's basketball, whether it's cross country, and the other tennis, the other sports that take place during the fall. We hope that we get to a point where the entire year's worth of sports isn't lost, but we're not there yet. And I think it's important not to politicize this issue, but to think about how we best do the job to keep our young people safe. We've seen in other areas of the state and across the country where precautions were not taken, infrastructure wasn't in place, and then you see this huge outbreak that happens. We don't want that anywhere in Illinois, and we certainly don't want or need that here in Chicago. But ultimately, the decision is made at the state level.
Just one last one. While we've been here, the White House announced millions of rapid COVID tests going to states to get schools reopened. Will that help CPS?
Well, the White House has said a lot of things during the course of this pandemic, many of which either weren't true when they were said or never panned out. And so I want to see it to believe it. So if we get additional tests, of course that will help. Will it make a difference in our ability to get people back in school? I'm not so certain. Certainly we welcome additional testing resources. The devil will be in the details. But fundamentally what we need is, in addition to more testing, we need people to continue to be diligent and follow the public health guidance. That is what's going to make a difference in whether our kids get back in school. If adults take this seriously, we're going to be able to get kids back in school. If they do not, we're going to continue to have challenges. Thank you all.
Thank you, Mayor.